Hey, how's it going? This is Chris from Kayazo's Clinic. Just making a video to possibly help someone with some neck pain. I want to give you something that I do when I'm feeling pain more in this area of the neck, this side area here. Goes up, sometimes it goes up into my jaw, maybe up in this area a bit as well. So a quick technique that I do, quick education on the muscle. You have scalenes, what's called scalenes in here. They attach to the lower ribs in here and up to your vertebrae on either side of your neck. This triangle here is a no zone. Don't go pushing around in there. You can see that there's a muscle here, right? This lines that triangle. That muscle is called SCM, sternocleidomastoid. Big name, silly muscle. I found that it's pretty submissive, so it lets go pretty fast. And some things in here sometimes will also refer pain, like trigger points, that kind of thing. So I will often work on this by just, I'll have my fingertips here, and I'll get my thumb in, grab that muscle. You have to sometimes get into interesting positions, turning your head. But I'll do that. You want to be careful if you're going to mess with this muscle because it slips and now you're just pinching skin here. So don't let it slip. It is uncomfortable for sure. Beyond that, so the muscles I want to get into is the scalenes here. So with the scalenes, right, you have your pulse over here. We're not hitting that area. We're on the outside here. So if I'm turning this way, right, you have your collarbone right here. So I'm going above the collarbone, right here. You won't feel a pulse. And so what I'm going to do is with my fingers, I'm just going to drag up, just so you can feel that area. What you're going to end up feeling, most likely, is probably some tension, like, wow, that kind of sucks. And it will, as long as ideally you're not feeling pain. You shouldn't be feeling sharp shooting pain, anything like that. Or you should probably get that checked out. You probably will be uncomfortable. There'll be some uncomfortability, some soreness a bit, but pain, you don't want to feel pain. So as you're in here, so now you're in this area again, you have this muscle which kind of lines the no zone, right? So you're on the outside of that muscle. And I'm going to put my fingers here. I'm going to look towards my fingers, and then I'm going to look up. And I'm going to feel a stretch. As I'm looking up, I'm going to pull down towards my clavicle, right? So up, down towards my clavicle. All at once here, right? We'll do this side now. I'm going to find that muscle. I'm going to go on the outside of it. I'm going to look toward, pull down with my hand, and look up. You might feel a little bit of a stretch. You also might feel a little bit of stuff going on in the back of your neck there. Something to be taken care of. I can take care of that for you as well. But sometimes it just helps take the edge off by getting into this area and doing that. And once you start pushing around that area, once you start navigating this area of your neck, you'll start to notice some tension and different things that can pop up. So let me know what you find and how the results are. Do you have any more mobility? Do you have any more headache, less headache? Even just tension in general. What are your findings? I found that it helps me, especially when it's that season and I'm starting to get sick and things start getting, staying away from the lymph nodes up here. Again, that's in that triangle. You don't want to be in that triangle, right? So outside here, and then just a little bit of a stretch. And make sure you're pulled down so you're not forcing your head back as much. You want to pull down, not force your head back as much. You're really just going up and away, right? It feels great. It's wonderful. All right, so Kayazo's Clinic, quick tip. Again, my name's Chris, do massage therapy, and I'm so happy to work with you and help you out with your neck pain. All right, have a good day.